So the new moves on the virus from the government are the travel restrictions, of course, from Italy. Anyone arriving has 2 weeks in isolation.
My expectation now is that those who may have been considering travelling to New Zealand for holidays will be reconsidering that travel, not least because it means they will be confined to one space for a period of 14 days if they choose to do so.
Also, the warning over cruising, which we've already covered off this morning. Health Minister David Clark is back with us. Good morning.
Good morning, Mike.
The fact that WHO's called it an hour or two ago a pandemic doesn't really change anything, I take it.
That's absolutely right. I mean, the Director General of Health in New Zealand has been saying for some time this is a pandemic in all but name, and that's why we moved with those decisive moves all the way along, because the urgent and early actions are the ones that have the longer payoff.
Is health going to get some money next week as part of the package that Robertson's announcing or not?
Look, I would expect there may be some announcement around this. We're working through just exactly what would help longer term. Of course, it's been clear to me from the start and made clear to me from the start that resource won't be a constraint in this area. We need to put our people first, make sure we've got the public health stuff happening that needs to happen. And so we've already shifted money around to make sure that we can do what we need to do.
And the reason I ask that, because flu's coming, is that a stress?
Oh, we've ordered 30% more flu vaccine. We've got that here than we've had last year, and last year was a record season for flu vaccine. So there are things we're doing which we know we can do proactively.
Do you get the sense, as each day goes by, and what we've done is pretty good so far, that we might get out of this, health-wise anyway, unscathed?
I don't think that we will escape completely unscathed. There are going to be cases that continue to turn up in New Zealand. That's going to be the new reality. As it spreads, as we've seen in Europe and in other places, we should expect cases to turn up. It's what we do from there, the systems we have in place that will make sure that New Zealand is not affected in as negative way as elsewhere in the world.
When I say unscathed, obviously we've got cases already, but I'm not too... Would you see hundreds, if not thousands? I don't see that now. There's a big enough gap. Aren't we seeing enough to understand that it's reducing in China? 93% of the cases in the world are in 4 countries. A couple of them at least have that under control. We can feel increasingly optimistic, can't we?
Well, we can look to those countries that have brought it under control, that have had cases. I mean, Taiwan, Singapore, even the actions of South Korea where it got really big. That decisive action they've taken, and the self-responsibility of citizens, people taking it upon themselves to make sure they wash their hands regularly. OCD is going to come into its own here, Mike. People who wash their hands regularly, who stay home when they feel ill and don't go to work, those sensible personal responsibility things are what's going to help us get through this.
Well, I'm glad you raised that. Susie Wiles, who you would know, she's got a runny nose and suddenly she's in the headlines in the news. She's staying at home. Are we all staying at home for a runny nose? I mean, at what point do you draw a line and introduce some common sense?
Well, I think in the modern world, people can work from home more easily. I think this is one of those times when it pays to be cautious. We know that that when you go to work, you spread it to other people. That's the risk in all of that. We are saying, if in doubt, don't go out with this stuff. Those symptoms pass. If they're mild, they don't take long and they pass.
Do you know anything about today? Anything coming today at all, case-wise?
Today, case-wise, I'm not expecting any cases at this stage. I certainly haven't had a briefing on any cases coming through.
Appreciate your time very much, David Clark, Health Minister, with us this morning.